All right. Well, welcome everybody to August 26th, GW Office of Integrative Medicine and Health and AIM Health Institute weekly series of meetings. GW Office of Integrative Medicine and Health is an administrative organization designed to support and promote integrative medicine, not just at GW University, but at the broader DC area. And AIM Health Institute is a 501c3 nonprofit organization dedicated to delivering alternative and integrative methods for people on limited budget, as well as those end of life. And today, your presenters are wonderful Dr. Jennifer Rooks, who's one of our, and I know I screwed that up again, but I'm in a couple of years, I'll get the spelling right, who will be doing our mind-body part today, and myself, and I'll be talking about intermittent fasting and fast mimicking diets. But before that, we'll get it open, you know, the drill, questions in the chat. My personal update for everybody, of course, is all about upcoming, starting next week, BA.4/5 boosters. Yeah, so Susan, I don't know if Susan's here. I don't see her. She sent an email earlier this week. Yeah, she's here, saying that, well, first of all, she sent an interesting article saying that there's some opinions of some experts that this new boosters are the best thing ever since the beginning of the pandemic and the rollout of first vaccines. I'm going to politely, cautiously disagree with that completely. I actually don't think boosters are going to change a whole lot. And I've been wrong before in a pandemic, so I will, of course, be very happy if indeed boosters change the pandemic. Yeah, so on a practical level, Susan asked an excellent question. She said, so what is the sort of general recommendation now as to how often should we be getting the boosters in general? And, you know, it's actually not an easy question to answer, but here's the way I think about it. And again, don't necessarily quote me on that. That's my personal opinion. It's not actually the consensus among physicians. So I'm going to recommend to relatively healthy patients who are not at risk of severe illness, so patients who are under 65 and patients who don't have some kind of a chronic complex illness or immune deficiency, that the boosters are given once a year. That will be my recommendation. Patients who are at the higher risk, I probably will be individualizing. I'm not going to tell you, oh, every 6 months. And that has to do with, because I would like to individualize it even further. So some of you who are my patients, I may tell you, actually, yeah, you may be over 65, but you're actually quite healthy. And I may say, no, we're still going to go with once a year. So that's the first bracket. Second bracket is a little different. The second bracket has more to do with whether or not you had an actual COVID. So if you had a COVID less than a year ago, which of course many of us have, then I would still apply the same principle. 12 months after that COVID, I would say get the booster. However, with that, I would say if your last booster was a long time ago and you had less than 12 months ago an actual COVID, I think getting the new booster as soon as it's available is very reasonable. So that's how I frame it. I don't know, Susan, if that's enough for your answer. Susan, if you don't mind, put that link you send us in the chat. And I see there's a lot of other things. So first, Jada, we're trying to bring acupuncture and massage back, but there's no funding at the moment, unfortunately. So we are, we've had multiple discussions with leadership, specifically with Dr. Abramson at BRED, but you know, we can't go back in there without the funding. Okay, Al, thanks so much for putting the studies. Thank you. So I think those of you guys, I don't know if you, I may have posted that last week, but I've analyzed one of the study, I think the Lancet study that is in there about long COVID. I've analyzed it on my YouTube channel, so I'm going to put link if you want to see my personal opinion on that study. And I don't want to, because today is not really, I think I covered that last week or last Friday. Okay, so boosters. So Novavax, my opinion, is not a booster yet, right? And it's not yet available. They're talking about getting it approved. So we're basically just talking about Moderna, Pfizer. Okay, all right. And I guess that's it, right? That's all I see in the questions. Because Al's just put it, those were the comments. There were no questions. Okay. So yeah. So how should we do this? I usually take up to 3 more minutes and I don't see any questions. Maybe I should just start my wellness talk. And then if, oh, there we go. Benita. Is it true?
I joined late.
That's okay. Is that true that the new boosters are not undergoing clinical trials before release? Yes, I believe that's correct. Basically, they're saying, look, they're the same vaccines, so we're not going to compare them to placebo again. Oh, yeah, of course that they're going to sue each other. I mean, let me put the book again in there so you guys, if you're interested in all of the pharma industry, but you want to see the alternative view of it, definitely this book is great for it, because it highlights a whole situational moment in history that basically pharma in essence is the most profitable industry right now in United States of America. If you're looking at the private sector, I mean, there are other sectors like government sponsored, the military and all that, but if you're looking at the private sector for profitability as a general principle, and that's a problem. Like, you basically, our health has been profited by, and vaccines are not any different, right? So one of the problems of this whole discourse is that we're only talking about vaccine for COVID treatment, nothing else. Vaccines and drugs. There's not a single statement about lifestyle. There's not a single statement about, sleep, even things like this on the national level, right? There's no one covering this, right? Because that's how we live. So. Okay. One thing today, if you have a personal question to me, hold them off till next week, just because I'm kind of doing wellness talk and questions. So I feel a little bit like I don't want to detract myself, because in a couple of minutes I have to start presenting. So I'd rather we put personal questions to me to the next week, unless you want to ask them for everybody if you're comfortable, but otherwise no. Okay, I see more and more no mask wearing, like a comfort people have. What is your take on this? There's no change. So no mask outside, no mask in a small circle if you're comfortable with everybody in there. If you're going into a new place and there are only 1 or 2 people and you talk to them ahead of time and they're all vaccinated and you feel comfortable, no mask. Anything gathering of any size, mask, nothing different there. Of course, we're still a lot of outdoors because of the weather is nice and all, but that's probably also going to change upcoming fall. So yeah, I don't think there's any new variants except 4 and 5 as of today. So for now, the upcoming vaccine is supposed to be very effective. So yet we have to see whether it's going to stop the further spread, and that's still unknown. I don't know which one's going to be better. There's no comparison. It's a hard. Basically, I'm guessing we will be doing what we did in the beginning: get whatever one you want, whatever you can obtain. I don't think there's I don't think they're trying to cross or not cross. I doubt there's going to be any data in the beginning. So if you're not waiting and you're going to get it right away, I don't think you should think about it. You should get one that's practically easier to you, or just the way you think about it. Like if you had Pfizer, you want to get another Pfizer, by all means. I don't think crossing over here would be something important. And with that, I'm going to stop the questions. If you still have a question, shoot them in the box, in the chat, and then we'll see if we have time for them at the end. Other than that, I will. So today, everything is about fasting your body and your senses. So Jennifer and I have partnered on this. I'm actually, the older I get, the more I learn how important it is to periodically fast everything in your life, including your senses and being away from connection to electronics and things like this. So today it's all about that. So I'm gonna go ahead and share my screen. And let's see. Okay. Guys, are you seeing my slides? Can I see a nod?
Yes.
Okay,
Yes.
great. Okay, so I'm gonna start the slideshow. Okay, so let's dive right in. First, I'm going to show you guys real briefly. Those of you who've been following my work know how much of a fan I am of blue zones. If this is a new term for you, blue zones are the areas where there's the highest percent of people living to 100 and staying healthy till that age. And there are certain core nutritional principles in all of those zones. I'm not gonna, today is not a blue zone conversation. If there's a popular demand, I'd be happy to revisit blue zones and talk about them as a whole topic. But the different, the similarities are, really none of those have processed foods. The processing, if it does occur, it's natural processing, like natural fermentation, for example. Highly variable caloric intakes from different macronutrients. So the ratios of carbs, proteins, and fat are all over the place. There's not any kind of a single unifying principle. Very little to no simple carbs. Majority of carbs are complex, although not all. So there are definitely some simple carbs like honey, for example. Presence or absence of alcohol all over the map. Seventh-day Adventists are no alcohol, Okinawan, very little alcohol to almost none, but then Sardinia, Korea, wine is like a river, and I'm not kidding, and not just wine, some stronger stuff too. Very high percent of plant-based, and but percent of animal foods is highly variable, so it's very interesting. Fermented foods are, but mostly non-alcoholic, although some alcoholic too. And then seafood is yay or nay. So notice almost no unifying principles except for just a few, except in a big one, and that's how I'm starting today's talk. That is the intermittent fasting. So the intermittent fasting seems to be uniform. So every single blue zones have it. Interestingly, all except for one, the Seventh-day Adventists, they fast for kind of a much more of a spiritual reasons, but also for health. Actually, they figure that out because it's a newer zone. But the traditional zones, including Japanese one, Okinawan, they're all did it from necessity. So it just so happened, like if you're Sardinian, they're shepherds, they just had to go for a whole day and they couldn't really eat because there was just no place for it. So a lot of this evolved not based on, oh, I'm going to be healthy, but it's based on, that's just my life is because I don't have access to food during those hours. So it's a necessity thing. But with that, it's just evolved. So before we go into actual fasting, you're really critical to understand glycolysis versus ketosis. So glycolysis, which is literally means sugar burning, and then ketosis, which is literally means fat burning. So those are the two most common states for our metabolism. They're not the only ones, but they're really the 99%. I'm not going to go into 1% of what's left. It's just really irrelevant for most parts. And the main difference is that the sugar burns fast and it gives us less calories, but it also burns a little dirty, meaning when the sugar is burned, it triggers insulin release, which is in an excess, immediately triggers inflammatory reaction. So the moment, and the same goes with the very high protein diets, because the protein and the carbs are the only two foods that are capable of spiking insulin. Fat cannot. There's no mechanism for which, no matter how much fat you eat, you're going to increase insulin production. So the way the system's set up. There's really no clinical use, in my opinion, for excessively high carbohydrate diets. There's been some attempts at certain studies, and there's even been some champions of this approach, but I'm not going to go there because clinically speaking, there just hasn't been anything controlled. And the ketogenic diets, so the very high fat diets, they have actual clear indications. So seizure disorder, it's nearly a standard, especially in pediatric population. It's also getting close to be a standard for some other neurologic diseases, including Parkinson's, Alzheimer's, and brain cancers. But that's still yet not quite there. And unfortunately, the safety is unclear. So with that, I just told you that, look, the sort of the evidence for pure glycolytic diets versus pure ketotic diet or ketogenic diets is questionable. So with that, what can you do better in terms of saying, okay, should I be doing other things that help me to go between burning sugar and fat? And the answer is yes. So you can do one of three things, right? You can calorically restrict yourself. You can dietary restrict yourself. So you can try to cut out some of the specific macronutrients without caloric restrictions and see what happens. And then you can also fast. So the dietary restrictions, we kind of just covered. I said that if you're going one way or the other, whether it's a high fat or high sugar, doesn't seem like there's a lot of absolute clear clinical indication for those, although for high fat, it's gaining some popularity. But why is this whole conversation, it comes in such a profound way left and right, and among not just biohackers, but among pretty much a very large proportion of people who are thinking of health and staying living longer? Well, because of some of the scientific data that basically points out if you put dietary restrictions on simpler organisms, yeast, worms, flies, and mice, you're seeing a pretty dramatic increase in longevity, and you're also seeing a quite significant decrease in effects on the genome. So you're basically having a lesser problems. And that's all sounds wonderful. And then the question is, so then why are we not calorically restricting all of us, right? If there's data. Well, turns out we do have controlled studies that are really good in monkeys. So if you take a monkey and you're 30% calorically restricted, 40%, sorry, then you basically can cure a lot of problems and you can improve things. But turns out you're not living any longer. So, all-cause mortality was basically the same. And you get like, pretty happy-looking monkey here and pretty skinny, sad-looking monkey over here. So the question is this, is there any role for future long-term caloric restrictions non-stop? And I think the answer is very clearly no. There's been human experiments done. I'm going to spare you because I only have limited of time. I'm just going to stick with the controlled trials. But long story short, the caloric restriction as a long-term approach is really a dead in the water. I don't think it will ever come back. And so that leaves us essentially with just intermittent fasting. And intermittent fasting itself has been proven to do these things that are listed here. So it's decreasing inflammation, improvement in insulin sensitivity, resiliency to stress toxicity, ischemic effects. And again, the how specifically to intermittent fast is all over the place. And then I'm going to show you just some practical aspects in the next slides, which are more or less, I would say, a current standardization as of today. So can everybody do it, first of all? Well, there are exceptions, right? So the children should probably not do it. Pregnancy, absolutely not. Chronic illness, you should be very careful, and you also should be very, very careful if you're frail, older person, or if you're recovering from acute illness. So those are the category of patients I'd be super careful about talking about it. And that has more to do with the fact that, yes, it's kind of sounds nice not to have insulin spikes, but then yet, if you're really unable to effectively utilize fat, it can actually cause more harm than benefit. And we've seen clinical problems with ketogenic diets. So I would say that the continuous being in fat burning state without some supervision, at least periodically, is probably very problematic unless you're very young, healthy, and robust. And of course, there has to be a standard precautions of doing it very carefully. So this is one of the probably most universally easiest to adopt method that you can try on your own without even talking to your doctor. And I would start with just 12 hours. So basically, it means that you will stop your dinner. Let's say you have your dinner at 7 and you stop eating, or let's say 6:30, and then you stop eating by 7. And then you're going to have your breakfast no earlier than 7 a.m. So that is very easy. And in fact, probably if you think about your life, personally, most of us are already doing this. Now, some of us may be doing it a lot longer. I routinely tend to do something like 8 to noon. which is a lot longer than 12 hours. So it's really more of a 16-hour kind of an interval. Sometimes I would even do 24 hours, but we're not really discussing that. So those are much deeper processes. But the 12-hour start is quite easy for a lot of people. Sometimes if you're really used to a very late nighttime snack, sometimes eliminating that snack is actually harder than pushing the morning first intake further out. So if you're one of the people doing 10 p.m. snack before you go to bed and your system is very used to it, you could try to push your breakfast till 12 a.m. the next day gradually. And then the frequency could be every day or could be most of the days of the week. Okay, so of course you can also there's lots of other strategies. So one is skipping lunch. That's pretty straightforward. So you just basically go, let's say, from breakfast to dinner and you have nothing for lunch. So this is often what's described as 5-2 diet. I will show you in a second where that comes from in terms of the book and in terms of specific references. So this is a typical breakfast for 1,500 calories diet would be somewhere, let's say, a little less than a third of it, so 350 to 450. So if you cut out just the lunch, and let's say you're going to have a typical breakfast and then a typical dinner, you're cutting out this amount of calories. So the question then arises, should you just bump up calories in the morning and at night? Well, that's the whole point. So if you're going for intermittent fasting without caloric restrictions, if you're just doing a regular 12 hours to 12 hours, it's not formally intermittent fasting. It's a timed restricted diet. It's a little different. To actually fast, you'd have to decrease total caloric intake on X amount of days per week. So that not to be confused. But if you absolutely never done it, I would start with just timed restricted eating, meaning that you're just eating only at particular times, but you're not actually restricting calories. Okay. So, and then of course there are more aggressive methods which are actually more effective for certain things, where you will be doing a prolonged intermittent fasting, like 24 hours or even 36 or 48. I'm actually not going to spend any time on those because those strategies are pretty complicated. If you've never done them, you should never attempt them without medical supervision. And I generally say that anything 24 hours or more requires medical supervision if you've never done it. And I'm against dry fasting with very, very few exceptions, and only in a very specific situation with supervision. Dry fasting means no water at all. So it's just no food, no water. That's a very sophisticated approach. So the fast diet is the 5-2 diet, so to speak. This is the one where I was mentioning that 2 days a week, you're cutting one of the meals, typically lunch. And that is a very, Michael Mosley is one of the early people who promoted this approach. So that's his book. And then intermittent fasting diet for beginners, which is a very also good by Alison Moody's on an online resource. Okay, so I have 5 minutes, so I have to talk about fast mimicking diet in 5 minutes. So what is FMD? So FMD is, by the way, I don't have a moment right now, but I will try to do it when Jennifer is talking, is to put interview podcast with Dr. Longo that Jennifer and I did a while back, talking about this approach. But basically FMD is an attempt at mimicking the intermittent fasting by very specialized diet. So it's a 5-day, moderately restricted, high-fat ketogenic diet, where your deep ketosis starts at around ketosis starts at day 2 and 3, and then quickly progresses. And then you gradually, after day 5, you reintroduce the food. So let's take a look what it actually looks. So, you're basically, this is actually what happens. So in the first a day or so, not much happening, you're kind of just generally adapting. But then day 3, 4, 5, you have this pretty significant molecular cellular shifts. And that's consistent if you're doing intermittent fasting on a more regular basis. And I think that I'll show you a slide comparing the intermittent fasting to fast mimicking diet. So these are all things that aid benefits, so to speak, that are been promoted by FMD, by Prolome. This is all directly from their website, so you can always find that. and you know, it's actually gotten a lot cheaper. This is outdated price. You can probably get it now for close to $100 as more people buying it. It's very, what I don't like about it, it's highly processed food. You get this box with a bag of soup with some olives. So olives is not processed, but like you get this bars and you know, and it looks very artificial in a sense, although it tastes okay. And some things are pretty straightforward, like the powdered soup is just powdered soup. If you're used to camping food, then it's actually going to taste like a glorified glamping food. And it is calorically restricted. And yes, that's all you eat. You just eat what's in the box. You can make it yourself. I don't recommend it. It's convoluted, but if you really want to, because it saves a lot of money, you actually can do it. So there's a link. Everything's going to be recorded, so you'll see that link. So there's a link if you're interested in taking a look how you can make it at home. And this is the book that Victor Walter, published, and it outlines everything in a great detail. If you haven't read the book, it's actually a very useful book. It goes into a lot of detail on sort of why this is one of the key approaches to healthy aging and longevity. So, and I think this is one of the last slides. So this is how I think about comparing the FMD and the IF, for intermittent fasting. So the biggest pros of IF, it's free, right? You're not eating anything, so you're actually saving money. But it's not as easy to start, believe it or not. And also you have to organize your life around that to some degree, versus the FMD is actually extremely easy to start and a lot less side effects. So you get this box, you know exactly what you're going to be eating. If you're traveling, you can do it. You can do it in any settings in essence. But of course, there's a complexity involved. So that's a cons because you have to either prepare it or pay for it. But intermittent fasting, you're going to have a little bit more side effects, especially when you're starting. And definitely if you're going for 24 hours or more. Efficacy, that's hard to say. Side by side hasn't been done. I'm guessing it's going to be kind of similar. And I think the FMD generally has a much larger overall potential for two reasons. So one, the studies on FMD are very specific. They're looking, for example, combining FMD with the chemotherapy for breast cancer, seeing a much better outcomes in the small early studies compared to the regular breast cancer treatment. You know, and it's also because it's much more controlled and it's also much more structured, people tend to end up in a deeper ketosis because it's 5 days and it's really hard to do 2 or 3 full days of intermittent fasting in a regular living. You have to really delegate yourself to like a full retreat when you're doing a more than 24-hour fasting. But, you know, of course, if you're on a limited budget, then IF is much bigger potential. And that's it. I think with this, I'm going to actually stop sharing, check the chat, answer one question, yeah, or maybe 2, and then hand it off to Jennifer. So let's see. And I know I'm dropped out checking the chat, so I'm sorry. I'm going to go back there and see what's there. Is snacking in between meals discouraged? Great question. So generally, I'd say yes. If you're particularly on some specialized high frequency diet for your reason, then that's totally fine. But generally, if you're aiming at doing intermittent fasting, I mean, you're not going to be snacking. Your choice actually could be a very high fat snack, like a pure fat snack. So the bulletproof coffee concept I didn't really discuss here because I ran out of time, but that's one way you can sort of maintain your fast by, say, taking a tea or coffee with some coconut oil or MCT oil. Coffee with 4 ounces of milk, yes. So that, 4 ounces of milk? Yeah, it doesn't matter. Any caloric intake of more than, I think, something like 10 or 20 calories will constitute not fasting anymore. So if you take a coffee with 120 milliliters of milk, 120 milliliters of milk will give you a good chunk of calories. So you're done with fasting at that point. Are there any patients or conditions that do not benefit or worsen? Yeah, so anything frailty related, any condition that is related to a frailty, like let's say, dizziness from severe chronic illness or severe deconditioning, like those are the patients who should not be fasting. Then for that reason, fasting in advanced cancer gets very problematic. And this comes up in a clinical practice all the time in my practice, because I often see very advanced cancer patients and you have to sort of make a decision, is there any benefit at all? Because people often try intermittent fasting with advanced cancers, and it's very complex there. I'll do last question and then we'll end, even though I know I probably didn't answer all the questions. And thanks for everybody who's putting in comments. So I'll answer this one because I actually have seen. So for patients with EDS, dysautonomia is one of the most important treatments in my opinion. Unfortunately, it's often done wrong. So you have to, if you have a lot of problems with the regulating your nervous system, if you start wrong, you're going to end up with a bigger problem. So patients with EDS have to be very careful. They should probably work with somebody who knows what they're doing. And I would be careful trying FMD with those patients, fast mimicking diet, because again, that's a bit more complex. So I probably would start, if you want to do it yourself, start very, very slowly, but would consider it as one of the interesting adjunct treatments. So yeah. And yeah, and by the way, like the whole premise here is very evolutionary supported, right? Because as humans, we evolved to go for long periods of times without food. And we've learned over the years to get adapted to that. It's very similar to the changes in temperature, which is, at some point, I'm gonna come back to the high and low temperature exposure, and we'll talk about that. Okay, with that, it gives me a great pleasure to introduce my own colleague and partner in crime, Jennifer, who's gonna talk to us about Ayurvedic way of looking at this, because it is a little different. It's just going to clarify a number of points from a much more holistic approach. What I gave you is a lot more of a kind of a biochemistry and a kind of a modern science of medicine look at this. But I think it's really critical to understand some of the more traditional way of looking at this. And we're also going to do some practices related to the sense fasting, if you will, or we'll see how Jennifer will define that.
Okay, thank you, Misha. So yeah, there are so many different perspectives on fasting, and Ayurveda has a very ancient science of when is fasting appropriate, under what conditions, who is it right for, who is it not right for, etc. And I would say, in the most basic way, the reason that fasting works is because it's giving the body a break. Our body is working very hard all the time to do all kinds of metabolic processes, immune system repair, hormonal balancing. It's constantly has multiple competing work orders that it's attending to. And fasting just takes one work order off the plate, if you will, for a period of time. So in that sense, I mean, we all fast as if we finish our dinner at 7 and we wake up at 7 and eat at 7, we're doing, it's kind of typical, right, in many instances to do a 12-hour fast as a normal part of life. But Ayurveda does everything according to the constitution of the individual. As some of you may or may not know, that the constitutional types are Vata, Pitta, and Kapha. Fasting is most appropriate for a Kapha predominant individual or an individual with a Kapha imbalance, and least appropriate for a Vata predominant individual or person with a Vata aggravated imbalance. And we can go into a little bit of why that is, if that's interesting to people. But there are many, many instances in which we would not recommend fasting. Ayurveda has a highly elaborated theory of metabolic fire, which we refer to as Agni. But the condition of your Agni, is it functioning well? Is it erratic? Is it low, or is it spiking high? These are all things that have to be taken into consideration when considering something like fasting. If a person with a high spiking metabolic fire fasts, then that fire can go higher, and in a situation like that can feed systemic inflammation. So we have to evaluate all these features of the individual, not just their constitution and imbalance, but what is the condition of their metabolic fire. In some situations, for example, one of the types of fasting that we do use in Ayurvedic medicine is fasting as a mono diet. And so mono diet just means you eat the same thing every day, all meals for a period of days. some people might think it's a bit boring, but what it does is it gives the body an opportunity to downshift the digestive process. The food is high protein, complex carbohydrate, and well spiced with carminative spices. So it's going to provide gradual detox by virtue of carminative spices, but also provide gradual detox by virtue of eating the same thing every meal for a number of days, because the body, again, it's the same kind of message to the body. Oh, you can attend to other matters. If things need repairing elsewhere, I'm just going to eat this same thing for X number of meals for X number of days. So you can take that off your worry list. And that is a type of fasting that is used in Panchakarma. Panchakarma is detox and rejuvenation therapy in Ayurvedic medicine. And it just refers to 5 actions. Pancha means 5 and karma is action. And it's one of the 5 actions, is this mono diet. So we do that on, there are occasions when a person might do a juice fast for a period of time, maybe for 24 hours or something like that, intermittently with water. But the specific type of juice is very specific to the constitution and imbalance of the person. There are many instances in which, the instances that Dr. Kogan mentioned, but also other instances when fasting is inappropriate. So certainly young, elderly, pregnant, debilitated in any way, where there is, significant cellular abnormality, so things like cancer, and where, in Ayurvedic medicine, we think a lot about whether the natural intelligence is functioning at a cellular level. And oftentimes when there is a tridoshic imbalance or a complex state of disease, then we know that kind of cellular decision-making has gone off the rails. And in a situation like that, fasting is not always great because the communication systems in the body are not working well, right? And you can start referring to those in biochemical ways as signaling mechanisms and things like that. But it's useful, I think, just to think about them as a communication system in the body, and the communication is off. If you just anthropomorphize it and think about, when we're very tired and overwhelmed, if we try to have a complex conversation, sometimes it really doesn't go very well because we're not firing on all signals, and physiologically the body responds in a somewhat similar way. So another instance in which fasting would be inappropriate is a situation with high toxicity in the body, because that kind of just dumping of toxic, when we fast, we do burn toxins, first in the GI tract, but also in other tissues of the body. And when we do that at a very fast rate and kind of dump a toxic load into the body, if we are not otherwise quite well and in a state of resilience, that can cause additional chaos and, provoke the context for establishment of disorder and disease in the body. So, I'm just going to leave it there for a minute, see if people have questions, and then I can move on to Ayurvedic theories about sensory metabolism, which are quite important. I'll just mention quickly, so I did a clinical trial of Ayurveda and yoga for obesity, but one of the things that gets neglected in treating chronic lifestyle conditions, oftentimes, when you take a very kind of biochemical or non-holistic approach, the condition of the nervous system is not attended to. And the truth is that the nervous system must always be in a functional form in order to engage, for the rest of the body to engage in healing. So for instance, for people that want to lose weight, oftentimes they'll say, well, I've done everything. I've done calorie restriction. I can't lose weight, etc. And then if the nervous system is on high alert, the body is simply going to be in a state of putting out fires, if you will. And it's not going to turn its attention to reconfiguring metabolic activity. So we have to attend to the condition of the nervous system prior to considering the utility of fasting in any situation. So that's one thing. And let's see, what kind of foods can be eaten or one food for several days? Okay, so what we typically use in Ayurveda is called khichdi. So it's mung beans or lentils with either basmati rice or brown basmati rice, and it's heavily spiced with carminative spices. And depending on the individual, there may be the addition of ghee. So, you know, there's some controversy in holistic nutrition circles at this time about, you know, the role of protein, the role of fats, et cetera. I mean, I was just at a conference where fat was completely demonized as a very problematic thing. And, you know, there were certain people saying it should be cut to zero, which makes no sense in my view, but Ayurvedic soul food, yeah. But it depends on the person. What is the tolerance for fats in the diet, and what's the most appropriate type of fat? So there are oils that are heating, oils that are cooling, there are oils that are light, oils that are heavy, etc. So we evaluate the energetics of food and make appropriate recommendations for inclusion of oil based on the person's constitution and balance profile. Now, ghee is typically included in khichdi, except if the person has a kapha imbalance that you're treating, then you would not have the addition of ghee. But ghee is considered very special in Ayurveda because it is a cooling and soothing oil and nutritive, and it has the ability to repair the lining of the intestines. And so it is often used in this kind of situation. So some people are writing things like coconut or avocado. So avocado oil is, I would say, according to Ayurveda, more neutral in terms of who can work with it optimally as a part of their diet. Coconut oil is good for pitta because coconut oil is cooling by nature. It's also light by nature, but not so good for kapha and not so good for vata. So it depends on, again, that constitution and balance profile. Any other questions? So, so I'm going to just take a little bit of a turn here and talk about sensory metabolic fire. So in Ayurveda, Agni, what if you're Vata Pitta? Well, everybody has every dosha inside of them. It's a matter of proportion, right? So what is predominant, what is secondary, and what is tertiary? So it's always nice to know your whole constitution. In other words, I have primary Pitta, secondary Kapha, tertiary Vata. But we often, when discussing kind of applying the science of Ayurvedic medicine, we'll just say Pitta predominant or something like that. But if you were Vata Pitta, and it is possible to have two doshas equal in prominence. And so if you're Vata Pitta, and I'm not sure what the question is, what if you're Vata Pitta, what type of oil do you use? But we're never treating the constitution, we're always treating the imbalance. So even if you're equal measures of Vata and Pitta in your constitution, we need to know what is your imbalance. And then that's the answer for what oil to use, what diet to use, etc. Ghee is a type of clarified butter. Yeah, I mean, we have to always think about fat content when we're talking about oils. So when you have somebody with cardiovascular disease, you would just use very minimally, depending on the rest of, you know, their health comorbidities and their imbalance profile. You would either use minimally or not use, so that it sort of depends on the person. The only answer that is always correct in Ayurveda is it depends. So that's important to know when asking questions. So let's elaborate a little bit. Yeah, ghee is okay for somebody who's lactose intolerant because the milk proteins are removed. It's clarified butter. The concept of Agni in Ayurveda is, again, metabolic fire, but Agni exists not just in the digestive tract, it exists in every tissue and organ of the body, and also in the sensory organs and at a cellular level. So there are theories about sensory digestion in Ayurveda that are very important for understanding. You're not going to eat for both your doshas, you're going to eat for your imbalance, unless you're fully balanced, which is, most of us are not, just to answer Benita's question. So when Agni at the level of the sensory organs is very important, because just like an overload of food or inappropriate food or the wrong kinds of food, too much and even sometimes too little, we're talking about fasting, but too little food is also problematic. It will negatively affect the digestive fire in the GI tract, and similarly in the sensory organs, too much sensory stimulus can be very problematic. The sensory organs can become overwhelmed, and ultimately you can have sensory toxicity. So there is a word in Ayurveda and yoga called pratyahara, which refers to withdrawal of the senses. And it's like sensory type of fasting, right? So you may sit in a dark room, you may keep silence for a while, it's Vata people tend to talk a lot. And one of the ways that they can rebalance Vata dosha is by being silent for a period of time, not when I was in Ayurveda school, I mean, people would be, charged with silence, and would simply wear a sign saying, I'm not talking. So, maybe not so easy if you have to go to work or something, but on a weekend, you can engage in fasting the ears and the hearing, the sense of hearing. A lot of conditions are informed by sensory overload: headaches, migraines, anxiety, depression. What are the type of Agni we have in our digestive fire is also present in our senses. So a Kapha type person has sluggish digestive fire, and that will also be present in the senses. And so they may be more overwhelmed more easily with a lot of sensory input. But also the senses are specific to the doshas to some degree. So the ears are specific to Vata, the eyes are specific to Pitta. So if Pitta is high, one wants to do a visual fast. And likewise, too much sensory stimuli. So for a person that stares at screens all day, that will aggravate Pitta dosha over time. So same with hearing, with touch, taste, all of the above. So, so when I have, for instance, a patient with migraine, one of the things I ask them to do is, at the premonitory sign of a migraine, any type of sign that they are aware of that precedes the onset of migraine, go lay down in a dark room with a heavy blanket and an eye bag, do a lot of deep, relaxed belly breathing. And, because if we can head nervous system aggravation off at the pass, we can really prevent at least that state informing the onset of disorder. So it is very important to do sensory fasting on a regular basis. A lot of us do it almost never, except when we're asleep. Some of us, if we don't sleep well, the mind is quite active while we're sleeping, and the senses are still kind of at work. So it's an important part of a sleep hygiene routine. And, to obviously get off screens, not watch a particularly upsetting television, but at least an hour before bed. 2 hours is even better, to put down the screens, turn off the television, etc. Meditation is a form of focusing awareness, especially internally, and of quieting the mind. But it depends on the type of meditation, whether it's also a sensory fast. Like some people will meditate with mantra. Well, then you're not resting, the organs associated with sound, with either producing or receiving sound. So some people, I have a lot of clients who come to me and they'll say, well, I was taught a counting meditation. So a counting meditation is also not really, it's a way to restructure the focus of the mind, and it's basically a tool to create one-pointedness, but it is not actually a dropping of effort from the mind. The mind is still engaged with something. So there are various forms of meditation. Some of them are more and less sensory oriented. But what I thought I would do today is a quick tutorial on Bhramari Pranayam, which is sometimes referred to as the bumblebee breath. And this does include both sensory withdrawal. There's a sound that you make, but the most traditional form includes sensory withdrawal because one plugs the ears and puts the fingers over the eyes. And so it's actually shutting off those avenues of sensory input. And so you can go ahead and try that if you would like. So just plug the ears and put the index and middle finger over the eyes. And then what we're going to do, so if you want to try this, just make sure that you are in an upright seated position and that you feel comfortable. And then I want you to just tuck the chin slightly. And we're going to breathe in a deep exhalation, and a deep inhalation. On the exhalation, we're going to hum. So I will demonstrate for you. And if you want to look, you can, or you can just listen and follow as I do. And go ahead and complete 10 rounds of that. Okay, and just have the next inhale, exhale rotation be your last round. No, so just to answer Mark's question, the hum continues all the way through the breath. And I think sometimes the earphones make it so that it sounds like the hum stops, but the hum is all the way through the breath to the complete final point of exhalation. And then there's no effortful stopping. There's just a natural next inhalation that proceeds. And you can do this, doing it sitting up is actually a little easier because of the humming, but you can try it lying down. But this kind of Bhramari pranayama is very useful for insomnia, for anxiety, for any kind of overwhelm, mental fatigue, brain fog, circulating thoughts, any kind of obsessive or compulsive kind of thought process in the mind. And what it does is it creates sort of an internal echo chamber kind of environment. And I like to say that it's kind of like a buzz sander for the mind. At some point after 3 or 4 breaths, one has difficulty remembering what one was thinking about prior to starting. So I think Bhramari pranayama is a great example of an intentional form of sensory withdrawal. Though there is the humming, it really creates a focus on the interior cavity of the body where the sound is resonating. So that's kind of what I wanted to share today, but I'm always happy to take questions. And just to say that sensory toxicity, according to Ayurveda, can funnel into physiological toxicity. There's that much of a connection between the two, so that if we allow our senses to become overloaded and develop toxicity within the sensory organs over time, that type of metabolic slowdown at a sensory level can inform metabolic slowdown at a physiological level, which is the thing that is kind of interesting to people when they learn that.
Wonderful. Well, thank you, Jennifer.
Thank you.
By the way, these practices are, and I'm a little bit familiar with some of them too, from some of my Sufi work, very similar actually. They can be very profoundly strong. So don't do them for prolonged periods of time, especially when you restrict not just hearing and eyes, but all other senses, because they're deeper practices. And maybe we'll follow up, and I'll at some point lead one of the practice where we'll repeat this. I find this practice is essential for me personally. I think I'm definitely have a little bit of latte excess. I have no doubt of that, and I think treating that with the approaches like this, and the other thing I really like about them, that you could do them very quickly in the middle of the day, and actually they shift quite strongly and quickly and profoundly. So you don't have to sit there for an hour to meditate.
All right. You could do it before a job interview, before a difficult conversation with your spouse. I mean, really, they are available at any time.
Or after.
Yeah.
So, all right. Well, we even have a couple of minutes for questions left. I don't know if I covered everything. I'm sorry. It gotten a little rushed today just because, you know, we're doing a little bit of everything. But
Doing a great job, Misha.
thanks. All right. Well, I don't see any more questions. I tried to even individually answer a few people. I don't know. I'm sorry again if it wasn't a little satisfactory. Sorry about that. But other than that, everybody have a wonderful weekend. Janet, what do we have next week? I don't know if you have from the top of your.
Let me go and
Yeah,
check.
Maria. All right. And of course, Jennifer and I will be back sooner or later to do more.